Hi, everybody. Welcome to another edition of Bay Area Regional Medical Hour. I'm your host, Abbey Lee, and we've got some phenomenal people here that we're going to be talking to today. We have Dr. David Fairweather, who is a general and trauma surgeon. We're going to be talking about trauma mainly, and Stacy Shipp, who is our trauma program manager at the hospital at Bay Area Regional Medical Center. So we're going to be talking a lot about trauma. I promise, if you are just tuning in, we are not going to be showing pictures or video of blood, so it will be okay today. We will be talking about it, so just bear with us, but it won't be too gross. We also have Bethany Hoover. She is our Director of Specialty Services. Did I get that right?
That's correct.
Okay. She is going to be talking about stroke because we just went through our stroke accreditation, and we have a lot of information to share with you about stroke. So for those of you who don't know about Bay Area Regional Medical Center, we're the big blue glass building on Highway 3. You can't miss us if you're going down the street. We've been open for about 3.5 years. We're in pursuit of level 3 trauma designation. We have the highest level chest pain center accreditation. We're in pursuit of primary stroke. We have a center of excellence in bariatrics and hidden scar surgery. We also have an amazing event coming up on Thursday. It's our Mom and Baby Extravaganza. So if you're pregnant or thinking about becoming pregnant, please come to our event. You'll get to meet our OBGYN, some other vendors, our whole staff, lactation consultants, childbirth educators, everyone that's part of the hospital. Take a tour and get some cool stuff. So if you're interested in learning more about that, go to barmc.us and you can register there. It's a free event. It'll be Thursday at 6 p.m. in the grand lobby of the hospital. Okay, so we're going to be talking about trauma, and I'm sure that everybody has some sort of like trauma story. I didn't have like a trauma, but I have a story that I had that it like affected me, a traumatic story, haha. So, but first I want to talk to Dr. Fairweather about some of his stories as a trauma surgeon, because, you've got probably some crazy stories that a lot of us haven't seen or haven't been around. So let's start our conversation, Dr. Fairweather, and talk about trauma. So tell me a couple of I know you have 2 stories that have really stuck out in your mind through the years of being a surgeon. Why don't you talk to us a little bit about those?
Well, first, let me say hello to everybody. This is David Fairweather, MD, general surgeon, trauma surgeon. And yes, I've done quite a few traumas. I've been in medicine for over 20 years, and I've seen pretty much almost everything. But I have to admit that when somebody tells me or asks me what's the thing that stands out, I have to admit it's probably the first time I ever seen somebody truly pass away, and in a trauma.
Oh, that sounds scary.
Yeah. Older man, he came in. Apparently, he was in altercation with his wife. He apparently was beating his wife. Oh. And she stabbed him in the chest. And he came in. He was talking to us. He was cursing us out, telling us to leave him alone.
He had it coming. It makes me think of that song.
Hey, well, hey, I'm not advocating. I'm not advocating anybody stabbing anybody, but hey, don't beat women. That's it. Hey, don't beat women. You get what you get. You get what you get.
So he came in with a stab wound to the chest.
Stab to the chest, yeah. And he was talking to us, and he was cursing us out, and he was not a nice guy. And I was a fourth-year medical student. This was in Detroit, Michigan, Wayne State University. And at that university, they really got the fourth-year medical students involved with the traumas. And I was on his left arm, and my responsibility was to take his blood pressure. And we did it the old-fashioned way. We put a cuff on his arm, and we put a stethoscope there, and we listened for the highest bangs that we were here. And basically, I didn't get a blood pressure reading on him. And I tried again, and I didn't get a blood pressure reading on him. And he was still talking to us, and the chief surgical resident, who honestly, he didn't sort of like me. At least I got that impression. He was just yelling at me, telling me to give him the blood pressure readings. And I told him over and over again, I didn't get anything. Eventually, he sort of pushed me out the way, and he basically tried himself, and he tried to assess the patient's blood pressure. And then he tried again, and then he tried again, and then he looked up at me. He goes, I don't have one either. And then all of a sudden, the patient just collapsed. And all of a sudden, we started doing CPR. We did something called cracking his chest, where we basically it's a thoracotomy, where we open up his chest and we open up his heart chamber, and we saw that there was a big blood clot in his heart chamber. It's called a cardiac tamponade. And
all these big words.
Yeah,
Okay,
yeah,
we're learning something today, man.
A big blood clot in his heart. So the big blood clot stopped his heart from pumping.
Okay.
And basically they tried to sew his heart closed, and the guy didn't make it. And and that's the first time I've seen somebody actually talking to you, responding to you, pass away. And it's stuck in my mind all this time. And because before, there'd be somebody coming in and they're already doing active CPR, and that person
they're not really
pass away.
responsive.
Yeah, that they'll talk to you, but this person actually is talking to
And
me.
you said that he
responding
was
to me.
cussing you out.
Yeah, cussing me out. Yeah, the blood pressure's too tight, and cursing me out, and and later on that night, the chief resident, who honestly, and I've seen this, I felt this feeling that he's felt every time when somebody does pass away. You second guess everything. You think about everything. Did you do everything right? Do anything wrong? Could you have did it better? And he came up to me, and this is a guy that I truly didn't think liked me. And he goes to me, I wish I would have listened to you earlier. And I know he was kicking himself. And honestly, I don't know if they could have did anything earlier, or because this is really from a few minutes that the guy was there. He wasn't there a hugely long time before all this happened. But I know how he felt, and I felt that feeling in my own self, where somebody came in and they've had a bad outcome, and it's something that sticks with you. Yeah, this is real. This trauma stuff is real.
I can only imagine what that's like.
And it's something that you have a dedication to try your best to save somebody in the worst times of their lives.
So when most people think, obviously you just brought up the stab wound to the chest, but I would think that most people, when they think of like traumatic injuries, they think of like car accidents and things like that, right?
Right.
But that's not necessarily the case for all traumatic injuries that happen and that we actually see in the hospital. Why don't you talk a little bit about what kind of other traumatic injuries someone might get?
Would you believe that the most traumatic injuries that we get are people falling?
Really?
Falling. You have an elderly person, your grandmother, your grandfather, and they slip and fall in the house. Those commercials that you see on TV where people slip and fall and they can't get up, not trying to advertise for anybody.
Yeah.
But that is real. That is real. We see a tremendous amount of older people.
Like what kind of percentage do you think of falls versus anything else?
Well, I'm not sure. Maybe Stacy can have better stats but very high.
Really?
Yeah.
60% versus everything else?
Yeah.
Wow.
Yeah, because
more than half.
Yeah, because a lot of people fall, they break their hips, and they come in, they're on the floor for a long time. They're calling for help for hours, sometimes days. And sometimes days, and by that time they're well dehydrated, they're unconscious, they're developing bed sores on their wounds, and electrolyte imbalances, and sometimes suffering heart attacks just from a fall. There might be even develop like some things called pulmonary emboli, bone embolism, air embolisms, and it could be significantly traumatic. So hold on. We're talking about falls and people falling, and that being the most prevalent thing for traumatic injury. Now, is this someone who is older and they fall, or is it like a weekend warrior type of thing where they fall off the ladder or fall off the roof? Is this all encompassing, or a little bit of both? It is all encompassing, but primarily it's elderly people falling.
Wow.
Yeah. So that's what we see the highest population of, but any of those could be a trauma. There's different classifications for different ages on what makes you a trauma patient after a fall, but our highest incidence is elderly people, but all of those are trauma patients. If they fall a certain amount, a certain height, and they could all be traumas.
And if they take a blood thinner medication,
Correct.
that's what we're really looking for. If they're on blood thinners like Eliquis, or Xarelto.
That you always hear on
Plavix,
TV all the
Always.
time.
Absolutely, because those things, I mean, they save your life, but they can also kill you because these patients fall and they break something, or they jar their head, they break a blood vessel, and once they start bleeding,
They don't stop.
they don't stop.
And
And,
if-
they might present even slowly. It might like not happen the day of the fall, but like maybe 2 or 3 days later. So when they come in, we make sure that they get a CAT scan
Yeah.
of the head and make sure that we don't see any bleeding in the head.
Wow. Okay. So that first segment went by so incredibly fast. So if you're on Facebook Live or listening to us on the radio, hold on tight. We're going to be back in just a minute. We're going to finish talking. We're not going to finish talking. We have a lot to talk about on trauma and stroke. So y'all stay tuned. We'll be back in just a minute.
Is your medicine cabinet overflowing with unused and expired medications and don't know what to do? Call the Bay Area Alliance for Youth and Families. Ask about free medication disposal pouches with a patented technology that neutralizes the drugs and makes them safe for disposal. Or you can save the date for Saturday, April 28th, when they'll once again be hosting medication take-back sites across the community. For more information, go to ccisd.net/alliance or call 281-284-0370.
Lori Coppett.
A name you can trust.
Lori Coppett.
A senior mortgage loan originator with Prime Lending, serving the Clear Lake area for over 28 years.
Lori
Why are you saying it like that?
Coppett.
Helping hundreds of satisfied clients with their home loan needs.
Lori
Seriously?
Coppett.
If you're purchasing, refinancing, or renovating your home, visit lcoppock.com to get the professional service you need. NMLS number 176539, Equal Housing Lender.
Lori Coppett.
Oh, for God's sake.
Hi, it's Keisha. You may know me as the host of the Libra Lounge, but I'm also the owner of Before the Cake Events. We are a wedding and event planning boutique. We add a touch of magic in every detail, from custom designs to full day of services, and our packages can be tailored to fit any budget. Look us up on weddingwire.com and on Facebook and Instagram under Before the Cake Events. Sit back, relax, and enjoy your special day while we direct everything before and after the cake.
Do you ever wonder how every insurance company seems to boast about having the best rate for you? With so many companies, how is it possible that they can all have the best rate? Well, the reality is they're all telling the truth. Kind of. You see, each insurance company has a different set of target customers that they're looking for, so each company will have the best rate for someone. The challenge is finding the one that likes you the most. Perfect Policy evaluates you through more companies than any other insurance agent, and that's how they find the best policy for you. It just makes sense. More options means better value. Contact Perfect Policy today.
Welcome back to Bay Area Regional Medical Hour on Vinyl Draft Radio. Hi, everybody. Welcome back. My name is Abbey Lee. I'm your host of Bay Area Regional Medical Hour. Today, we're talking about trauma and stroke, and we were having such an interesting conversation about trauma. And so we talked, actually, while we were on break, there was a miscommunication on the the percentage of number of falls that we see in our hospital. Yes, did I get that right?
Yes.
So we see more like 90%. Is that what you were saying?
Yeah, more like 90% of our traumas that we receive in our hospital are falls, whether it be the elderly falls or the ones that
You fall off the ladder.
fall off the roof. Yes.
Wow.
We are Fall Nation.
Okay, so question now. Can trauma injuries be prevented?
Absolutely, and I think it has to deal with more or less, education. Say even from the standpoint of the weekend warrior, the person wants to go out there and have some adventure. Do it safely. Wear helmets. Wear safety equipment. Depending on what they're doing. If you're going to be in the water, wear life jackets. There's just some things that you could do to prevent injuries. If you're going to be doing sometimes we'll do things like diving, and they'll have come back with a spine injury.
Yeah, don't dive in shallow water.
Don't dive in shallow water. Know how deep that water is before you do some diving. If you're going bike riding or you're doing some things on a trail, know the trail. Don't go on a trail that's where you're going to notice there's a blind curve and you go crashing into a tree.
Speaking of biking, oh my gosh, I have to interrupt and tell you this quick story of me riding a bike. So I grew up riding bikes my entire life and I never wore a helmet. Okay. So then my husband and I decided that we were going to get official road bikes. And he was like, no, you're getting a helmet. And I'm like, no, I don't need a helmet, dude. It's really okay. And he was like, you are getting a helmet.
I like that. I like that.
Oh, okay, fine. Can I at least pick a pretty color?
Yes.
Anyway, so
I like your husband doing that. That's right.
So
That's right.
we were living in the Woodlands at the time, and we went like on a 40-mile ride on a Saturday, and there was this big dump truck behind me, and it freaked me out, scared me, because I'm like, oh my God, is this person going to run over me? And I turned back around, and I look back forward, and I'm on like the part of where the cement is and then the grass, and I fall off my bike and I land like on my shoulder, road rash everywhere, and everybody's like, are you okay? I'm like, just get me out of the road because there's this big truck coming. So anyway, we look at my helmet after the fact, and my helmet in the back was completely cracked.
Wow.
So
I have a helmet for
Saved
you
your life.
to replace
Listening
it
to your
if you need
husband
a
right
that's
Saved
great.
your
I'm like,
life. That's
I am
right.
forever a person that
Helmet
says
saved
wear
your
a
life.
helmet,
Right.
please, all the time. Thank you.
And we've done bicycle safety, and Webster Fire Department, shout out, so graciously donated some bicycle helmets for us to do bicycle safety with the children in the area. So
That's
we were
awesome.
able to do that.
And, just like prevent the fall. I mean, we do know and see a huge amount of falls from my elderly population, some that weekend warriors, some other people, just kids, playing in the yards and things like that. And there's our programs that we have called Prevent the Fall, which is actually,
Oh,
education towards the community about, our elderly falling and how to prevent that.
Oh,
Yeah.
right. Yeah.
So does
do you
this
say?
have something to do with, like, if you have an elderly neighbor, not necessarily family, but you should check on them every now and then, make sure they're
Absolutely.
okay?
Yeah, absolutely. In this population right here in Webster, it's very small and very dense. And the elderly population, which is 55 and older, is greater than 12%. And that's a large population of elderly people on anticoagulants that fall. So we really like to target those people as far as education goes. We go to the nursing homes or the assisted living centers. We talk to them about falling, about going over their medications, because some of them are on lots of medications that react and may cause them to fall. Talk to the families. We just do lots of education when it comes to falling,
So
inside and outside the hospital.
That's awesome. So I have another question for you, Dr. Fairweather. So how is severity determined when you see a patient come into the hospital with a trauma injury?
Well, one, it depends on the trauma. If it's a motor vehicle accident, those traumas are a little bit hard to sort of determine what's going on. Sometimes you might have an obvious broken arm. But guess what? Somebody might have an obvious broken arm, but they could also have a spleen laceration. That they could be bleeding, and hemorrhaging in the abdomen. But everybody's looking at the guy screaming from his broken arm. So basically, we have to try to assess the patient as fast as possible. We usually start with making sure that the standard airway, breathing, and circulation. Make sure that they have an open airway, that they're breathing okay, that they have blood pressure and pulse. And then we go from there. We check their brain status to see whether or not whether or not they need to be intubated, where we put a breathing tube in, and then we go through the various injuries. In that example I talked about with the broken arm, we call that a distracting injury. Because,
Interesting. Yeah, because it distracts from something that's a little bit more important.
Right. And so
Okay.
we still check to make sure that the person's not bleeding in their brain, they're not bleeding in their chest, they're not bleeding in their abdomen or in their pelvis. And because obviously if you're bleeding and you're hemorrhaging, you're not going to be long for this life, obviously. A lot of these assessments are done where we're even using things like an ultrasound machine to check, for those areas, if those areas are full of blood. It's called a fast examination. We usually have x-rays, there immediately to see whether or not they have blood in their chest, broken bones in the pelvis. And we also, if the patient's stable enough, we could get them to the CAT scanner, and we could do what's called a pan scan, where we go and look up for their brain, their spine, their chest, their abdomen, the pelvis, and we could do that fairly fast. The CAT scanner is right beside the emergency room, and it takes us barely 30 seconds to get them from the emergency room to the CAT scanner to evaluate the patient. And obviously, if the patient is totally unstable for the CAT scanner, we might have to go to the operating room, where it's just a short ride to the operating room, and we can go ahead and deal with the patient in a surgical aspect. So as far as trauma, I mean, depending on what's going on, if it's a trauma from a blunt injury from car accident, or if it's what's called a penetrating trauma, where somebody has a stab wound or a gunshot wound, we go through the same pattern, make sure that their airway, breathing, circulation are intact,
right,
and go ahead and address their injuries as fast as possible.
Okay, so I am non-clinical and I work in the hospital, and I hear trauma alert and trauma activations. So he's pointing at Stacy.
Pointing at
me. but you were saying that there's an X-ray available and all these stuff. So do you have radiology and a bunch of people just storm the ER with all of their supplies? Talk me through that process.
That's actually how it goes.
They storm? Yes.
They storm. They storm. You'll see me running in first. Now, when we have a trauma alert, that's our level 2 traumas, and these are the patients that, okay, there's something going on, EMS has seen a potential, or they meet a criteria, like a patient that fell on blood thinners. And we have X-ray comes in, our doctors, our ER doctors, our nurses, and our techs, they come in, we evaluate the patient and see what happens. Trauma activation is our more higher acuity patient where they have the potential to go south very quickly. So once that is called, you'll hear that called over the hospital. It'll be trauma activation room, whatever. The whole trauma team comes in, and that
So does that mean Dr. Fairweather's
Dr.
coming?
Fairweather will be called, or the trauma surgeon that's on call, he'll be called. The ER doctor will be there, of course, our nurses, X-ray. We'll clear the table, the CT table, so that we'll have them ready. Blood bank comes down with 2 units of uncrossed and unmatched blood, just in case we got somebody bleeding. Yes.
Yeah.
Surgery is notified, and occasionally anesthesiology will pop his head in and say, okay, what do we got? Just to get ready.
Wow.
So we are on the ready. We'll have security to ride us up so nobody can come into the elevator with us. We can get that patient up and going as quick as possible.
Awesome.
Yes.
You were going to say something, Dr. Fairweather?
I was just going to say just what she said.
That's what I said.
Okay, so Bay Area Regional Medical Center is in pursuit of level 3 trauma designation. So can you guys talk me through what that designation really means?
Okay.
One for Stacy first, and then Dr. Fairweather.
Okay, so we're in pursuit of level 3. We've already had our survey, so we're just waiting to hear back. So
Yay.
We did really well. We are capable of taking care of our trauma patients with fractures, a various of fractures. We've got great orthopedic surgeons. Also, any kind of abdominal injuries, chest wall injuries, anything immediate, life-saving that we can go ahead and take care of. The only thing that we really are missing is like neurosurgery, and that's okay. We can stabilize that patient and get them to another hospital that does take care of that. And we have really good relationships with these hospitals. We can stabilize all the patients. We can stabilize them. Just the neuro patients are the ones that we're going to have to either monitor or we're going to have to send them elsewhere.
Yeah, and just to add on to that, during the hurricane last year,
Fun stuff.
We should talk a little bit about that.
That was the best time ever.
Oh yeah. But
maybe for you.
But there was a horrible time for everybody.
Yeah.
And Stacy, she said that it was really, she's doing it in sarcasm.
She was excited. She got to see lots of people.
Yeah. But basically, the other hospitals in the area, they were inundated with patients just like we were, but we had a system that was in place where we were able to keep things going. We kept the staff in the hospital and the volunteers, and we were able to continue to take patients through the whole entire time. And now our ER was open the whole entire time, and other ERs were closed down. And we took trauma the whole time, too. Although there were a lot of people that were stuck, a lot of people had suffered and sustained lots of destruction to the house, including myself. I lost 2 cars, and my bottom floor was destroyed. But we're still able to come in and provide service to the hospital.
Okay, hey, we're going to have to take a break. We actually are out of time for this segment, which is crazy. It goes by so fast, I know. So we'll come back and talk a little bit about Hurricane Harvey and our trauma, how we dealt with that, because that's an interesting conversation, too, to have. If you're tuning in live, hello, everybody. Terry says, yay, there's my boss. Hi, Patricia. If you guys have any questions, y'all please shoot them out on Facebook. And if you want to listen to us on the radio, you can listen live on Vinyl Draft Radio, or you can say Alexa or Google, play Vinyl Draft Radio, or the TuneIn app. So we'll be back in just a minute to continue our conversation on trauma.
Awesome.
We'll be right back to Bay Area Regional Medical Hour on Vinyl Draft Radio from the ACU of Texas studio.
Tucked away in the side streets of Kemah, the white exterior of Kemah Steak Company radiates a timeless essence. Behind the doors, a casual yet elegant dining experience welcomes their guests. They make sure your dining experience is nothing but the absolute best. Come in today and see why Kemah Steak Company is your perfect getaway. Kemah Steak Company is located at 707 Bradford Avenue in Kemah. Contact them at 281-334-9463. Reservations recommended on weekends.
Life is complicated. Work, family, emails, children, text messages, taxes, relationships. It's complicated, but your finances don't have to be. At Associated Credit Union of Texas, we understand. That's why we make it easy, with the accounts you need, the technology you want, and the personal services you deserve, without any gimmicks. Simple, straightforward, and secure. That's ACU of Texas's commitment to you. Get associated with Associated Credit Union of Texas so you can get on with life. ACU of Texas is a community credit union. That means anyone can join as long as they live in the area. That area includes Harris, Brazoria, Washington, Waller, and Galveston counties. ACU has 16 locations spanning from Brenham to Texas City. ACU of Texas has special accounts for military, veterans, and first responders. They take care of the people who take care of us. Federally insured by the NCUA. ACUTX.org.
There may not be such a thing as a time machine, but at iCryo, their machines can help you feel better, look better, and may even help you feel younger. See what everyone is raving about and how cryotherapy may be right for you. 5 locations to serve you. Call Kyle today at 832-474-3653 and find out what iCryo can do for you.
Welcome back to Bay Area Regional Medical Hour on Vinyl Draft Radio, coming live from the ACU of Texas studio. Hi, everybody. Welcome back. My name is Abbey Lee, your host of Bay Area Regional Medical Hour. And oh, my Lord, we're talking about Hurricane Harvey and trauma and all sorts of good stuff here. So there's so many people that were affected by Hurricane Harvey. I was one of them. Dr. Fairweather, you were too. But Stacy said that she was having lots of fun in the hospital during the hurricane. So what was one of your memorable experiences working at the hospital during the hurricane?
Well, of course, it was flooding everywhere, and I called my husband, shout out to Webster Fire Department, and he came and picked me up in his Suburban and got me through the flood and got me into the hospital. And when I got there, the night shift nurses, God love them, they're like, can we go home? And it's like, no, I'm sorry, you're locked in, you're here. Yeah. But literally, the patients had been dropped off in dump trucks. I mean, fire departments were going out.
But it wasn't just a dump truck. I saw, was it the National Guard also dropped off patients?
All kinds of patients.
And volunteers.
Yeah. So was it like by the dozens they would come in?
By the dozens they were coming in.
School bus drop off.
Boom, boom. And it was like, because right there on Highway 3, we're kind of higher up than everybody else. And then the little road next to us was kind of underwater. So they see us, the beacon of light, and they were just dropping the patients off. Wow. And the nurses were like, oh, my God. And it's like, you cannot close the door. The inn is open. Mm-hmm. Come on in. Yep. So these patients were coming in, and we did have a couple of really bad trauma patients. They were both spine patients. We were unable to get them to UTMB. The Coast Guard was going to swing by. Shout out to Clemcy for arranging the Coast Guard to come by and pick them up and take them, but the bridge was closed. So called Dr. Fairweather. One of them we were able to get out, and then he took care of the other one. So.
Awesome.
Yeah.
And they were in the same.
So one of the good things about that, I would say good things, that we have a good backup system.
Mm-hmm. Yes.
So the trauma surgeon that was actually on call, he was flooded in, and so they had called me. I was flooded in, but my situation improved, and I was able to come out to the hospital as basically the backup for all the surgeons. And so, unfortunately, when I got there Sunday afternoon, I had stayed there until Thursday, and finally got to go home Thursday. But basically, we basically covered the hospital, and there was this really bad trauma accident. There was a couple of people that were hit in the storm, and they both came in with spine injuries. One we were able to successfully get out, stabilize and get out to a trauma surgeon and spine surgeon, and the second one we kept. We tried to get him out, but again, the roads were horrible. We couldn't couldn't fly the helicopter to get the patient in. Even though we had accepting physicians at UTMB, we couldn't get him to UTMB. So actually we contacted a spine surgeon that is affiliated with the hospital, and he decided that he came in and he evaluated the patient. He basically took care of the patient. Everybody's doing well. I met the man and the wife. They both did very, very well, and they both are walking, although the one came in with an open spine fracture, which means
so how does that even happen?
Yeah, well, they were hit from behind, and it basically just jarred and broke their spines.
What hit them from behind?
Yeah, another car. They were parked on the side of the road, and another car lost control and hit, and they were in a truck, and somebody hit them, and the force of the accident broke their spines.
My Lord!
Both of them.
Wow.
And they did very well for the accident. They truly are, in my opinion, blessed that they got through that okay. So and they're both walking, talking, doing what they're doing right now. But the thing is that I really truly believe that if these trauma services in the emergency room, the EMS, are truly were responsible for these folks to even be alive. Much less just able to walk and talk right now, because spine injuries, as everybody knows, can be significantly deadly.
Yes, exactly. Or paralyze you or
Right.
something like that. Okay, let's talk about the different levels of trauma designation and what level 3 means.
Well, when you ask that question, we have to talk about what level 1 means.
Okay.
Level 1 is basically a hospital that could take on everything. So, and they, every service, ortho, neuro, urology, every service there is, trauma.
Stab wound to the chest.
Stab wounds, broken pelvises, ruptured bladders, everything. But they also have residents. These are doctors, but they're not attending physicians like myself. And they go through a certain years of training to become an attending physician. And that's usually level 1. Level 2 is basically similar to level 1, but there are no real residents, where they are able to take on the majority of the different services, but they don't have all the advantages of having residents there. And level 3, like we're trying to pursue, again, no residents, but and we have a couple limitations. One, we don't have neurosurgery for trauma, and we don't do pediatric trauma, particularly. Now, we don't. We do. If a person does come in, we are able to stabilize them and able to stabilize them and transfer them to other places. Now, one other difference between level 2 and level 3 is that with level 2, the trauma surgeon has to stay in the hospital 24 hours a day. And
but you get called in, or we have different people on call.
Right. We have every day, and then we have a backup system in case that one person is busy or tied up or can't make it. We have another surgeon that can take that person's place.
Okay. Let's talk about the Stop the Bleed campaign. What is that?
Oh, the Stop the Bleed campaign is a nationwide initiative to stop massive bleeding. Bleeding out or exsanguination is like the number 1 preventable cause of death. If you get a trauma patient who has lost a limb and they're bleeding out, let's teach the public how to stop bleeding. So we have gone out in the community. We've provided tourniquets, which are back in style. Remember, we had tourniquets, then they went out. Well, now they're back. The military has brought them back, and we have followed suit. Texas is really big, especially in this area, on pushing the tourniquet initiative. We have been educating the employees of the city of Webster. We've educated the Webster Police Department on how to put tourniquets on themselves in case if they're like shot while on duty. We have given tourniquets to different areas of the city of Webster to go with their defibrillator. When defibrillators came out, everybody's like, oh, we're not going to use that. Well, now there's a defibrillator everywhere, correct? Because it saves lives. Well, the tourniquet sits right there with the defibrillator because it's going to save a life.
Right. So are you seeing that more prevalent with the thought of mass shootings? Is that a coincide thing, or is it something completely different?
I can see, yeah, absolutely. It would go hand in hand with mass shootings. It will save lives with mass shootings. With car accidents, with falls.
Oh, yeah.
I've applied one tourniquet on a patient when I was in EMS, and all she did, she was just holding a mirror and dropped the mirror and
Oh, my Lord.
sliced her arm. So we just threw a tourniquet on that. So
Wow.
Tourniquet's supposed to be a last resort, but
Yeah.
I mean, by the time you get to the patient and they haven't been able to stop bleeding, let's wind them up. Let's get that tourniquet on them.
So we have one at my house that my husband bought that has little diamonds on it, and you basically have to stretch it out to where it looks like the first one. And he put it on me one day just to show me how tight it was, and I'm like, "Oh my Lord, take this thing off! It hurts
gets
so bad."
very tight, very quick. We use the combat application tourniquets, which are the ones that are similar to that they use in the military. It's a large piece of Velcro, and it's got a windlass on it, and you put the extremity through the Velcro loop. You make a loop, and then you
This is
pull
the
it
one that-
really, really tight.
the one that you twist?
Yeah,
Yeah.
it's like a little pin.
Yeah.
And then you take that windlass and you do that windlass until the bleeding absolutely stops, and they are going to scream and holler because it's not painless.
It's not. It hurts.
It does. And then you go ahead and you secure that windlass down, and there'll be a little tab on it that you write the time on when you put that tourniquet on, and then you don't touch it after that.
Well, a little bit of pain, but
Would
it'll
save
save your
your
life,
life.
yeah, which
Yeah.
is better.
Life.
Which
Yeah.
is better.
Yeah.
Yeah, so.
And everybody said, well, what if I lose my arm? It's like,
well, would you
what if
rather
lose
die?
Your life? Right.
Yeah.
But you
had
can
it
keep
where-
the tourniquets on for up to 2 hours.
Yeah.
Wow.
I had it where a guy was drunk and he fell asleep on the train tracks. I don't know why that happens, but it happens a lot.
Really?
Where
Interesting.
people get drunk and for some reason they go to train tracks, and basically his arm came back mangled, and they put their tourniquet on, and that basically saved his life.
Wow.
Unfortunately, we had to amputate his arm because it's so mangled, but
But he
we were able
lived.
to stop the bleeding
Wow.
and save his life.
Okay, so Dr. Fairweather, before we run out of time again, let's talk about you take care of other things besides trauma. Talk to me a little bit about that and where your office is located.
Well, my office is located in Webster. It's called Clear Lake City Healthcare Professionals. It's near the corner of Highway 3 and Clear Lake City Boulevard. And I'm a general surgeon as well as trauma surgeon. I also do some body contouring with some plastic surgery. And I'm a general surgeon by training. I trained at Morehouse and Emory in Atlanta, and I've been in practice in the Houston area for the past 14 years. And at the hospital, I'm probably the more senior surgeon out there. I've done several thousand surgeries in my lifetime, close to probably 20,000. And
Wow, that's a lot of surgeries.
I don't have a life. If anybody, people, they always make fun of me because they see me morning, noon, day, night, and middle of the night. But I want to provide a service for the patients.
Yeah. So do you have a website and a phone number if someone wants to reach out to you?
Yeah, my office number is 832-831-9877, Clegg City Healthcare Professionals.
Okay, awesome. Okay, so everybody that's watching on Facebook, hi everybody. If you have questions, we're going to actually talk to Bethany next about stroke. So you guys stay tuned. We'll be back in just a minute. We'll be right back to Bay Area Regional Medical Hour on Vinyl Draft Radio.
Hi, it's Keisha from the Libra Lounge. I'm the owner of Sassy Class Teacher and Spirit Boutique. We are a one-stop shop for all your custom and branded apparels, from t-shirts, hats, embroidery, yard signs, decals, door hangers, wine glasses, and so much more. We also specialize in teacher gear, bringing trendy fashion to the classroom. Look us up on Facebook and Instagram under Sassy Class Teacher and Spirit Boutique.
There's no one else like you. You are individually designed, so shouldn't your nutrition be designed just for you? Learn how to customize your life with ID Life. Go to myidlifetoday.com and find out how to live the life you want now. myidlifetoday.com.
Hey, it's Adam Smasher for Clear Lake Today. Look, when I'm looking to find a business, a service, or a place to eat in the Clear Lake and Bay Area, first place I look, clearlaketoday.com. All the info I need can be found easily on clearlaketoday.com. If you're looking to find a business, you need to check clearlaketoday.com first. If you own a business in the Clear Lake area, you need to make sure your business information is on clearlaketoday.com. To make sure your business news, coupons, videos, and more can be found on clearlaketoday.com. Contact Doug Meisinger by emailing doug@clearlaketoday.com.
Is your medicine cabinet overflowing with unused and expired medications and don't know what to do? Call the Bay Area Alliance for Youth and Families. Ask about free medication disposal pouches with a patented technology that neutralizes the drugs and makes them safe for disposal. Or you can save the date for Saturday, April 28th, when they'll once again be hosting medication take-back sites across the community. For more information, go to ccisd.net/alliance or call 281-284-0370.
Welcome back to Bay Area Regional Medical Hour on Vinyl Draft Radio. Hi, everybody. Welcome back. I'm your host, Abbey Lee, for Bay Area Regional Medical Hour. We've been talking about trauma, and I've learned some interesting stuff for our trauma segments that we had. But next we're going to be talking about stroke, and I hear that Bethany's been hijacked on Facebook, so this might be interesting. So you can ask as many questions as you want on stroke while you're on Facebook too, okay? So anyway, if you are just tuning in, you can also listen to us on the radio. You don't have to watch us live on Facebook, but we love to see your smiling faces and your comments on Facebook also. You can listen live at vinyldraftradio.com. You can say, Alexa or Google, play Vinyl Draft Radio, or you can listen in on the TuneIn app. You can download that. I think that's a free app that you can download. So let's talk about stroke. So the American Heart Association says that every 40 minutes, someone suffers from a stroke. I wonder how many strokes happened since we've been on the air. That quick math. I'm not that fast at math. So 80% of strokes are preventable also. So we'll talk a little bit about how we prevent strokes also. So Bethany, what is a stroke and how does it affect the brain?
Sure. There are several types of stroke. A stroke, by definition, is damage to the brain due to interruption of blood supply. So that means you have blood stops going to the brain, and then from that, your oxygen is delivered through your blood. So oxygen stops going to the brain, and then brain cells start to die.
Okay, so is the brain the same as the heart when it starts to die? What? She's looking at me funny. When it starts to die, or parts of your brain or your heart die, you can't, so say you break a bone, right?
Right.
Your bone can go back together.
Correct.
But your heart can't do that, and your brain can't also, correct?
Technically, no, but that's kind of a mystery. We have patients that have incredibly severe strokes and incredibly severe heart attacks, and then they're up walking around and have incredible recovery that we don't really expect. So theoretically, according to science, tissue, once it's dead, doesn't really regenerate, but it can repair and it can recover. So yes and no.
So is it like a rehab thing, or is just
it is
a
rehab
mystery?
Helps. It's kind of, to me, it's a mystery. I'm sure that someone who has spent a lot of time and dedication to research could tell you the answer, but it's interesting. You'll have patients that'll have what's considered to be a not severe stroke that have devastating effects, and then you'll have patients that have incredibly severe strokes that appear to be debilitating, and then you meet them 3 months later and
they're completely fine.
walking around. Yeah. It's very, very interesting.
Okay, so there's different types of strokes.
There are. So there is what's called a TIA. It's a transient ischemic attack. It's a lot of people call it a warning stroke or a pre-stroke. Those should be taken very seriously. They are just that. They're warning strokes. If you have a TIA, it's really not if, it's when you're going to have a more serious stroke that could cause debilitating effects. And then you have what's called a hemorrhagic stroke. They're not very common. Well, they're common. They're the least common of the 3 types of stroke, but they are the most deadly. They have the highest mortality rate. So people that have hemorrhagic stroke don't fare as well as others that have a TIA or an ischemic stroke. And then the third one, ischemic stroke, means a blockage in the blood vessel.
Turn your volume down. Sorry. we got really distracted there. Okay, so TIA, transient ischemic attack, warning stroke. TIA is like a mini
stroke, warning stroke, whatever you want to call it. And then hemorrhagic stroke. There's intracerebral hemorrhage and subarachnoid hemorrhage. There's 2 types of hemorrhagic. They're very high level, but they essentially are both hemorrhagic strokes, and they both can cause the same type of, they manifest their symptoms similar. And then ischemic stroke is the most common as far as between hemorrhagic and ischemic, and it is a blockage. So when you have a heart attack, bless you, a lot of people know when you have a heart attack, you have a blood clot that stops flow of blood in your heart. It's the same thing in your brain. So when you have a stroke, you have a blood clot, an ischemic stroke, a blood clot is cutting off blood supply to your brain.
Okay, so what happens to the blood supply in your brain during a hemorrhagic stroke?
A hemorrhagic stroke is you're hemorrhaging blood in your brain. So it can either be due to an injury, which isn't really considered, it's more of an injury, not really a hemorrhagic stroke, but it kind of manifests the same. Your blood is coming out. So you're still, if blood is escaping your blood vessels, it's not going through your vessels and supplying oxygen to the rest of your brain.
So is this something that can happen if someone falls and hits their head?
Yeah, like say the most common one is called epidermal hematoma. It's not to get too technical, but there's 4 bones that interconnect right behind your temple, and underneath that bone on your skull is called the middle meningeal artery. Ooh, it's getting technical now. And basically, when that artery is lacerated, then you'll have arterial blood flow pumping, and it compresses the brain and that area, and basically, somebody will have almost near immediate symptoms.
Super headache.
Yeah. Well, headache, and they'll the eyes or pupils, one will dilate, and they'll maybe go unconscious. And then there's another type that where basically it's the veins. It's not arterial pumping with pressure, but the veins will cause a deformity of the brain where it compresses the brain as well, and that also can cause problems. Say somebody's on blood thinners, it could be a significant amount of blood in the brain, compressing that side of the brain, pushing the brain to the other side, and basically causing sometimes a lethal outcome.
Wow. Okay, so when you have your brain controls everything on your body, right? So what kind of, how does it affect your body? I mean, are there strokes in mainly certain areas that affect certain things, certain parts of your body?
There are, so not to get too technical, there's so many different types, but the main thing is it can affect any part of you. So there are strokes that patients will result in paralysis, so they can't move a side of their body or certain parts of their body. They have what's called nystagmus, so their eyes, they have trouble with their eyes, with seeing certain vision fields are lost. People have trouble with speech after certain types of stroke. It depends on where the stroke is located in your brain, but all these things can happen. You can have one really bad stroke and have a combination of effects, or you can have just singular symptoms. I've seen patients that just have what's called word salad. They're trying to say, can you take the dog outside? And they say, table red, purple, dog, cat. And it just doesn't make sense.
Yeah, completely doesn't make sense.
They can't help that, right?
So what are the warning signs, or what are the signs of a stroke?
So warning signs, we teach an acronym called FAST. So updated acronym is BFAST. So BFAST, the B stands for balance and eyes, and those are symptoms of, signs of a posterior stroke. So balance, if you notice a patient that has
In the back of the head?
in the back of the
posterior.
head. Yeah.
I got that one.
So that's the most missed. So the American Heart Association added the B to the FAST acronym.
So balance. So if they look like they're drunk,
Balance.
but they're not.
Correct.
Okay.
So you know, if this one's tricky, right? Because you don't know who's drunk. At least you're like, oh, she probably isn't. But anyways, you have to, there's several things you can do. So if you suspect someone's having a stroke, ask them to stand up if they can. So can you stand for me? Stand still, kind of like what would be a roadside test for intoxication. The same
Yeah.
thing. Can you stand? Can you lift one foot up without falling over? Age is a factor, right? If you have a 90-year-old patient that can't do that before you thought they were having this, don't ask them to stand up.
Right.
Then you'll be sending them to my friend Stacy for a trauma. So don't do that. But ask them to stand up. Eyes, are their eyes looking at, are they able to look at you straight on without seeing
Is
an
that E?
eye? That's E for eyes.
E,
Yep.
okay. B.
Without seeing an eye kind of shift, you'll see this
It's like a
back
quiver?
and forth movement. Kind of, yes. And then fast, B-E, balance eyes. Face is for F. Is their face, do they have asymmetrical movement on their face? So can they smile and then one side droops down, or they just have some kind of effect that their face is not even? Face A. Arms, have them raise their arms. This is another balance test, but if they tell them to raise their arms up in front of them parallel to the floor, and if one arm falls down, that could be a possible stroke. And then S for speech, ask them to speak a simple sentence. Say, can you repeat after me? The car turned right on the street. Something very simple with short words that you can measure how they're speaking in comparison to how they were speaking to you 30 minutes ago, an hour ago, when you last noticed. And then time. Time is very important. Time is of the essence. There's lots of things we can do for strokes to minimize the long-term effects that it can have on a patient, but you have to get to the hospital fast.
Okay, so this isn't one of those things where, oh, I think this might be happening, but I'm going to do the dishes and then call 911.
Don't wait it out. Please do not.
One thing that, in addition, and I think this is just in general,
Yeah.
everybody needs to do, have a list of your medications and your medical
Yes.
problems on you or somewhere close, because sometimes we'll get patients in and they might have a fall and they might have a stroke or any other type of injury, and we don't know the list of medications, and all of a sudden, an hour or 2 hours later, a family member will come in and say, oh, they're on blood thinners.
Right.
And that's a big deal. So, and then it changes the perspective of what type of trauma it is. It could be from a trauma that's not level trauma to a trauma alert, which is a bigger deal. So,
Awesome.
But just in general, somebody gets in a car accident or anything like that, just have a list of your medical problems and list of medications on you, written down in a simple, little pad.
Okay, so we have just a few seconds left. This goes by so fast.
I know, wow.
So talk to us about, what does it mean that we're getting we haven't gotten it yet.
We're in
Why do I keep saying
pursuit.
that?
It's okay.
So,
We're gonna get it.
yeah.
We're gonna get it.
So what does it mean if we have our stroke accreditation?
Sure. So primary stroke accreditation, stroke certification, that means the Joint Commission came out, saw us, looked at all our processes, and decided that we are able and competent to care for these patients that are basic stroke patients. That means we can accept them, give them the best level of care, and be able to do all aspects of care from pre-treatment, post-treatment, rehab, all of those things.
Awesome. Okay, so we're going to have to stop this now. I'm so sorry. But if you're watching on Facebook or listening on the radio, you can go to barmc.us/stroke and learn more information about our accreditation and stroke signs and symptoms. We have a lot of education on our website that you can go to. And if you are a mom or you're pregnant or thinking about becoming pregnant, we'd love to see you on Thursday at 6. And till next week, we will talk to you later. Have a great rest of your day.